big topics today is the concept of stigma, HIV and stigma. As Eric mentioned today, they're kicking off Illinois ASAP. The Alliance for Sound AIDS Policy is kicking off a new campaign to eliminate stigma. And as Pete said, I've been working on healthcare reform, so I'm going to back up just a little bit. 9 years ago, diagnosed with AIDS. I had health insurance, quickly found out my health insurance didn't cover jack. Ended up going into medical bankruptcy to the tune of about $250,000. That's when I discovered Ryan White and the AIDS Drug Assistance Program. For a long time, I was pretty comfortable living with those two things. Several years ago, when our president said that he wanted to put forth healthcare reform, and I realized that I would have the option of once again being able to get a real job with real insurance, I was very excited. Now, I started working on healthcare reform almost immediately after the president made the announcement. But I'll be honest and say that for the first 6 months, I never disclosed my status. I would stand up in front of groups like you, and I would say that I have a long-term medical condition. Something that was kind of vague and out there. And about halfway through the process, I said, enough. They need to know. And I said, I'm living with AIDS. And to this day, when I introduce myself at a healthcare reform or these days, Affordable Care Act meeting, I tell people I am living with AIDS because they need to know. Now, healthcare reform is going to benefit us in more ways than we can even possibly imagine right now, which is why we need to fight for the Affordable Health Act, the Affordable Care Act, ACA. We don't want to forget about Ryan White and about the AIDS Drug Assistance Program. We need those for the next couple of years. But until 2014, when all of this law kicks in, we need to make sure that those are in place for us. But in 2014, hopefully, everyone that I see out here in front of me is going to be able to move from Ryan White and ADAP into regular health insurance, which will give us benefits that we cannot give right now. And the only way that we can do that is to keep doing what we're doing. And yes, I will keep using my big mouth, talking on Fox and Friends, and making sure that Fox and Friends, who are notorious for going in the opposite direction, know that I support healthcare reform. I'm not going to let them lead me down the primrose path and say that this was a bad decision. The high-risk pools, they might be a little bit out of range, and we have to work on that. But as Representative Harris said, as Representative Feigenhold said, we have to be able to sit down and take a look at what we've got in front of us, determine what our priorities are, put them in order, and work at them that way. Eventually, we'll be able to cover all of them. And again, I will continue to do this. I do it with your support, and I appreciate your support, and thank you very much for being here in Springfield.